A little bit about us. Of course, if you've been to one of these meetings before, we are the parent and family engagement team. What do we do? Parent and family engagement is an ongoing process that increases active participation, communication, and collaboration between parents, schools, and communities with the goal of educating the whole child to ensure student achievement and success. Some of the things that we do for families is provide parent and student programs and meetings, parent and student volunteer opportunities, and parent and student leadership opportunities. We recognize the value of parents and how to communicate and work with them as equal partners. We provide school parent compacts, parent and family engagement policy to families in family friendly language, and we provide resources and communications to all families, including English learner students and limited English proficient families. Um, okay. This is your family school partnership coordinating team. First, we have Ms. Veronica Opani, who works with primary and elementary, Ms. Sonia Welch, who works with middle grades, myself, Nayeli Hernandez Monarres, I work with secondary, Michelle Gilliard, which is our leadership and service, and Ms. Jennifer Lansing with special programs, who you will be hearing from in just a little bit. Our agenda for today. So, why are we here? What is sudden cardiac death? What are the causes? What are the prevention strategies, recognition, and actions? Um, where did my slides go? Okay, GCA health screening requirements. And that's on the agenda today, in case anybody was wondering what we're doing. Okay, moving on. So why are we here? All Georgia schools, public and private, including charter schools that have one or more grades, so 6 through 12, shall hold an informational meeting twice per year regarding the symptoms and warning signs of sudden cardiac arrest. At such informational meeting, an information sheet on sudden cardiac arrest with the symptoms and warning signs shall be provided to each student, parent, or guardian. In addition to students, parents, or guardians, coaches, and other school officials, such informational meetings may include physicians, pediatric cardiologists, and athletic trainers. So unfortunately, we don't have those. It's just us. So we definitely cannot answer any medical specific questions for you because we are not doctors. But if anything in this presentation should concern you, or if you feel like it might apply to you, reach out to your healthcare professional, to your pediatrician, anyone who's an expert in this. And of course, GCA does not currently have a sports program, but understands that many of its students may participate in local and travel sport programs in their communities. So to comply with SB 60, GCA provides students in grades 6 through 12 and parents with resources to inform and educate them on cardiac arrest prevention and awareness. And I believe there might be some links coming up. Okay. Oh, okay. Presentation in the group noteboard with clickable links. Awesome. Thank you. Okay. So what is sudden cardiac death? Cardiac arrest is the leading cause of death in young athletes. It's rare, but when a young, previously healthy athlete dies suddenly on the playing field, communities can be devastating. Young athletes are perceived to be a healthy group of individuals. They aren't supposed to die. Stirs up medical attention, discussion, and sometimes finger pointing among school personnel, coaches, administrators, parents, and physicians. So it's a very important topic. Um, so some causes of SCD in young athletes. By various mechanisms, these abnormalities cause the heart to beat out of control, called ventricular fibrillation or VFib. Um, Also, electrical abnormalities. This leads to the inability of the heart to pump blood to the brain, lungs, and the heart itself, causing hypoxic injury, lack of oxygen, which is the lack of oxygen delivery, and ischemic injury, which is the lack of blood flow, and death, which can lead to trauma infections. So, what are some of the structural abnormalities that can cause sudden cardiac death? An inherited condition that may run in families. So, a history of sudden death in a family member before age 50 may be the only clue to the condition. Hypertrophic cardiomyopathy. The heart muscle walls are thickened, which disrupts the flow of blood from the heart and disrupts the heart's electrical system during exercise. This can lead to ventricular fibrillation or VFib and cardiac arrest. A history of shortness of breath, chest pain, or syncope or dizziness during exercise may be a clue. A physical exam is usually normal, but a skilled physician in cardiac auscultation, there it is, may detect a murmur. Structural abnormalities, coronary artery abnormalities. The arteries that supply the heart muscle itself are connected abnormally and may get compressed during exercise and not provide adequate blood flow to the heart muscle. This results in VFib, cardiac arrest. Sudden death is usually the initial clue, but there may be a history of chest pain or syncope with exercise. Marfan syndrome is an inherited condition, so family history may be a clue. Abnormal collagen in the aorta may lead to rupture with exercise. Some of the characteristics are tall, slender, long arms, legs, fingers, an abnormal breastbone, high arched palate, extreme nearsightedness, curved spine, flat feet. These traits in any athlete should raise suspicion of the condition. Some electrical abnormalities, Wolff Parkinson White syndrome, an extra electrical pathway in the heart causes rapid heartbeat leading to VFib, usually born with the condition and can cause chest pain, syncope, and shortness of breath with exercise. Long QT syndrome is an inherited rhythm disorder causing fast, chaotic heartbeats, often causing fainting. And this can also result in VFib. This can occur when immersion into cold water occurs, as in swimming and diving. History of drowning or near drowning in a family member may be the only clue. Some traumatic injuries to the heart or commotio cordis. So, blunt trauma to the chest from a projectile, such as in lacrosse, baseball, hockey, or contact sports or martial arts, such as martial arts, at exactly the wrong time in the cardiac electric cycle may induce VFib, and it's more common in children due to a thin and compliant chest wall. Now, myocarditis, inflammation of the heart muscle, usually from a virus. Inflamed heart muscle can't tolerate the stress of strenuous exercise and goes into VFib. A recent viral illness, cold, flu symptoms, fever, or recent exercise intolerance may be a clue. Athletes with fever or recent febrile illness should not exercise until they are afebrile, which means symptom free, and have completed a gradual return to their exercise program symptom free. Some prevention strategies. So, the primary prevention is recognizing the warning signs of sudden cardiac death if they occur. Uh, Learn to recognize chest pain, shortness of breath, or syncope with exercise. Syncope in the middle of exercise versus at the end of a race, or fainting suddenly with loud noises such as an alarm clock, a phone ringing, or a doorbell warrants investigation. Chest pain or shortness of breath, often due to asthma or being out of shape, but these symptoms need to be investigated prior to returning to strenuous workouts. And remember the SB60. So, this get a yearly pre participation physical exam by your primary care physician, usually a pediatrician. Some more prevention strategies to sudden cardiac death. Sudden unexpected death in a family member before age 50 is a red flag to a possible inherited condition and warrants investigation. Drowning or near drowning in a family member could indicate long QT. Family history of a known cardiac disorder, Marfan syndrome, or electrical abnormalities of the heart warrants investigation. Um, and GHSA requires this form as of August 1st, 2019, and will not accept any other version. And this form is endorsed by AAP, AHA, and 5 other organizations. A thorough history and physical exam by a skilled physician is the primary screening tool in preventing sudden cardiac death. So I think something got cut off there, but there is a form that goes there. Some more prevention strategies. So, mass pre participation physical screenings in gymnasiums should be discouraged. I think that's what we're usually used to in a typical sport environment, because this format, despite being popular, often doesn't allow for a thorough history or careful cardiac auscultation due to the noisy environment. Performed by a provider that is not the athlete's primary physician. So that's one of the reasons that it's ineffective, because it's performed by a provider that is not the athlete's primary physician, usually an orthopedic surgeon not skilled in cardiac auscultation. Previous health records are not available, so they're unable to update immunizations with this format. Family history may not be reviewed by the parent and may be inaccurate and possibly miss important family historic clues that may be causes of SCD. So, some recognition and actions. Um, so, how we can recognize sudden cardiac death, whether you see them collapse or not, you must assume sudden cardiac death is a possible cause. Act quickly, call for help, be trained and certified in hands on CPR, obtain AED as early as possible and know how to use it. Every minute is critical during sudden cardiac death. Have an emergency action plan and rehearse it. Personnel assignments, so CPR, get AED, crowd control, call 911, unlock gate, direct EMS to victim, etc. Equipment location and accessibility, and a working phone. And now I think, yes. Okay. Now here is Miss Jennifer Lansing. Thank you all.
Good evening, everyone. So, what we're going to talk about next is the health screening considerations notice to parents. So, the goal of Georgia Cyber Academy is to promote the health of students within the school and the community by providing the notice of health screening requirements and considerations. So, Georgia's immunization requirements and school attendance Form 3231, the vision screening, hearing screening, dental screening, which is Form 3300, as you all may have remembered doing this when you enrolled at Georgia Cyber. The scoliosis screening, the health screen considerations notice for 21-22. This is a link that you, if you look at our present in the note board, the presentation link, and you download the presentation, you will be able to get the link for the health screen considerations notice for 21-22. And then the diabetes medical management plan. So Georgia's immunization requirements and school attendance. So the Form 3231. All students must comply with the requirements of the state immunization code. So the certificate of immunization, which is Form 3231, Georgia law requires that children attending school, kindergarten through 12th grade, to be age appropriately immunized with all the required vaccines at the time of first entry in school. A new entrant is a child entering a school in Georgia for the first time or entering after having been absent from a Georgia school for more than 12 months or one school year. All students, regardless of grade and including foreign exchange students, must have the Georgia Department of Human Resources Form 3231 immunization certificate marked complete for school, unless any of the following situations exist. And you would also be able to see the health screen considerations notice for the list of those situations. Again, that's in the group note board if you look at our presentation link. Here are some new immunization requirements. So, sixth grade immunization requirements. All currently enrolled children entering sixth grade on or after July 1st, 2015, must meet the following requirements: 2 doses of the measles vaccine, 2 doses of the mumps vaccine, 1 dose of rubella, the rubella vaccine, or laboratory proof of immunity against each of these 3 diseases. 2 doses of varicella, which is chickenpox vaccine, or documentation of disease or laboratory proof of immunity. At the time your child entered school, only 1 dose of this vaccine was required. So this is why it's a new requirement. Some more new requirements. 7th grade immunization requirements. Effective July 1st, 2015, all children born on or after January 1st, 2002, who are attending 7th grade, and children who are new entrants into a Georgia school in grades 8 through 12 must have 1 dose of Tdap vaccine, 1 dose of meningococcal conjugate vaccine. Then the new requirement for children attending 11th grade in the 2021-2022 school year, Before starting the 2021-22 school year, all students entering or transferring into 11th grade will need a meningococcal booster shot, which is the MCV4, unless their first dose was received on or after their 16th birthday. For more information about Georgia's immunization program or the immunization requirements for school entry and attendance, please click on one of the following links. Again, you'll be able to find those in our presentation link, and you can download and have all the links to that we've provided through this entire presentation. And that includes the Georgia Department of Public Health Immunization section and the summary of Georgia immunization requirements for childcare and school attendance. So some more of the screenings, which you guys would all be familiar with in enrolling your students here at GCA: vision screening, hearing screening, and dental screenings. A student, regardless of grade level, who has ever been in a Georgia public school must provide certification of eye, ear, and dental examinations on the Georgia Department of Human Resources Form 3300. Any child admitted to school without a certificate must present one within 60 calendar days. Forms may be obtained and completed at the local public health departments or physicians' offices. The scoliosis screening. So in Georgia, scoliosis screenings are required in at least 2 grades, 6th, 7th, or 8th. Scoliosis is a physical condition characterized by a lateral deviation of the spine away from the midline of the body. It is known that 2 children out of every 100 may have scoliosis. And if this condition is detected early and appropriately treated, progressive spine irregularity can usually be prevented. The procedure for screening is a simple test in which the child's back is examined in the standing position and then while bending forward. And here are some helpful scoliosis resources. Again, all these links that are available in the presentation, which is on the group note board. And these links are to Children's Healthcare of Atlanta, the United Way, and then there's a YouTube video on how to check for scoliosis. Your child's primary healthcare provider or health department can provide complete information for suggested screenings, programs, and any necessary treatment. Next, we're going to discuss the Diabetes Medical Management Plan. So GCA has a Diabetes Medical Management Plan, DMMP, per Georgia state law, OGCA 20-2-779, and it includes the training of specific school employees in the care needed for students with diabetes. GCA must obtain written permission from the student's parent or guardian to allow monitoring of a student's blood glucose and to administer insulin by injection or the delivery system used by the student. GCA would require this permission at any face-to-face event where monitoring or insulin administration would be needed. So in summary, get pre-participation physical done by a pediatrician 6 weeks before the season starts. Know accurate family history and be familiar with the warning signs and symptoms. Recognize warning signs if they occur. Have all coaches and personnel CPR certified and AED trained. Know where AED is. Have required screenings done for students' health. And read Project Save. So again, that link is available in our presentation link in the group note board. So we want to thank everyone for attending our presentation tonight. And if you would please fill out our attendance link, and that is also in the group note board. Our attendance link, if you could please fill that out. We really appreciate you joining us tonight, and we hope that your week is going well, and we look forward to seeing your students back in classes next week after testing ends. Thank you, everybody. Thanks so much for attending.